Scar formation. So first of all, you guys have to remember the basic things how the scar is going to form. As I already mentioned, there are some kind of you can say mechanisms in which your body cannot undergo when your body cannot undergo regeneration. So when your body is not undergo a regeneration, you will get the repair, and in the repair your body is going to form the scar. But before starting this you can say mechanism, we have to understand in the wound healing we have two main you can say terms. One is primary intention, and second is secondary intention. We have to first understand this term. Primary intention mean the wound edges are brought together that you can say with the help of suture, that will lead to minimal scar formation. So in the primary wound healing there is no scar formation, but in the secondary you can say intention, the edges are not approximated, the edges are not you can say come close together with the help of suture. You will leave themselves, they will try to you can say come close together with the help of myofibroblast. The myofibroblast will come and contract the wound, that will lead to scar. So if they ask a question from you, the scar formation is going to occur in which intention, primary or secondary? So it is the secondary. Why? Because in this the myofibroblast are going to contract the wound, and when the wound is contracted, that will lead to the scar formation. Then another important point is you guys have to remember what are the important causes of delayed wound healing. They can ask from you in exam, what are the causes of delayed wound healing? So if in your body you have infection, so what kind of bacteria that is the most common cause? Like Staph aureus is the most common cause. Then if you have vitamin C deficiency, like vitamin C deficiency, if you have copper deficiency, if you have zinc deficiency. So all these are the causes which can lead to delayed wound healing. And as I already mentioned, vitamin C is important cofactor in hydroxylation of proline and lysine pro-collagen. So that's why you guys have to remember, if you want to cross-link the collagen, you need the hydroxylation which is done by the vitamin C. If no vitamin C, no cross-linking, your collagen is not strong. Then after that, I already mentioned the copper. Copper is very important for wound healing. Why? Because copper is a cofactor for lysyl oxidase. Lysyl oxidase is an enzyme which will cross-link the lysine and hydrolysine to form the stable collagen. So that's why if you not have a copper, your lysyl oxidase will not work and your stable collagen will not form. Then after that, zinc, I already explained this. Zinc is a cofactor for collagenase. What is collagen? It is an enzyme which is going to replace the type 3 collagen with type 1 collagen. So this is about the you can say about the zinc. So these are the important points which you guys have to remember. There are also many other causes which can cause the delayed wound healing, like diabetes, then you have the malnutrition, ischemia, foreign bodies. There are many different causes. So before starting the scar formation, you guys have to remember what is the primary intention, what is the secondary intention, and what are the causes of delayed wound healing. Then after that let's talk the scar formation. So basically scar formation occur when repair cannot be accomplished by cell regeneration alone. It's mean when cell is not going to regenerate, then if cell is not able to regenerate, it will undergo repair, and when it will undergo repair, there is a formation of scar. You guys have to remember. Then they mention non-regenerated cells secondary to severe acute or chronic injury are replaced by connective tissue. It's mean those cells which don't have ability to regenerate, they are going to replace with connective tissue. Then after that, 70 to 80% of the tensile strength are regained at 3 months. This is very important MCQs. Approximately how many months you are going to get the tensile strength? Approximately at 3 months. A little tissue strength regain thereafter. Excess tumor growth factor beta is associated with aberrant scarring such as hypertrophic and keloid scar. So basically, as I already mentioned, tumor growth factor beta is going to repair, is going to participate in wound healing. So if in your body there is excess amount of tumor growth factor beta, that will lead to the hypertrophic scar and keloid scar. So let's discuss what is hypertrophic scar and what is keloid scar. Basically, hypertrophic scar, it is a condition in which there is excessive production of scar tissue that is localized to the wound edges. So basically, hypertrophic scar is what? It is the excessive proliferation of tissue that is localized to the wound. And here they mention in the hypertrophic scar there is a type 3 collagen is more, the collagen that is going to, you can say, organize in the parallel fashion. Then the collagen that is excessive, that is confined to the borders of original wound. You can see this is the original wound, and the excess collagen tissue is confined with the original border. You guys have to remember. Then it is, you can say, the recurrence is more common, the predisposition is not, you can say, more common. Then we have keloid scar. In the keloid scar we have the type 1 collagen and type 3 collagen more, and it is going to be disorganized. Then after that, you guys have to remember, it can extend beyond the border of original wound with the claw-like projection, typically on the earlobes, face, upper and extremities. You can see this is extending beyond its borders. So you can see this one. So this is not going to happen in hypertrophic scar. In the hypertrophic scar, excess tissue is confined to the borders, and it is, you can say, the recurrence is not frequent. The recurrence is not frequent, and it is going to happen in darker skin people. You guys have to remember this thing. So these are the important points which you guys have to remember. So let's take a again quick review. First of all, hypertrophic scar, it is the excessive production of scar tissue that is localized to the wound healing, wound edges, sorry. Then after that we have the keloid scar. Keloid, basically it is the excess production of scar tissue that is the out of proportion, to the wound. Then after that, if they ask question from you, how to characterize the keloid scar, basically it is characterized by excess type 3 collagen, and in this it is more common in African American people. Then also please keep in mind, it affect the earlobe, it affect the face, upper extremities. So these are the, you can say, the important points which you guys have to remember. So basically this is the you can say ending of our second chapter of journal pathology. And in the next class we are going to start the third chapter of journal pathology, that is the principles of neoplasia. So before starting the you can say the next chapter, I will like to share important MCQs with you guys, which are more commonly tested in your exams. So first of all, they will ask more questions from you in the wound healing phases, like what are the vitamins that are required. So please try to remember the name of vitamins. Then after that, you guys have to remember the difference of tissues like permanent, labile and stable tissues. Then after that, you guys have to remember the steps of wound healing, like phases of wound healing. So these are also very important. And after that, you guys have to remember the, you can say, the granuloma formation, like what are the types of granuloma, and you can say in which you can say you will get the caseating granuloma, and in which you will get the non-caseating. So these are the important points which you guys have to remember. And also in the end of this video, I would like to share how you guys solve the U-word question. So just 5 to 10 minutes, because this is going to be very important for you guys, because a lot of the students are currently solving the U-word MCQs question, but they don't know the mechanism, they don't know the strategy by which they should try to solve the question. So let's take an example. This is the first paragraph of your question. A lot of information is giving this paragraph, and they mention below this paragraph you have A, B, C, D option. So whenever you are reading the question, try to pick the important things. First of all, try to understand what the question is telling you. Second, pick the background information, history, allergic history, family history. Then third thing, ask from yourself what the question is telling me, what the question is asking from me. So first thing, what the question is telling you. Second, the basic background history. And the third thing, what the question is asking from me. So these are the important things which you guys have to remember. Then after that, try to, you can say, solve the options one by one by using the elimination method. So these are the important points which you guys have to remember for your exam. So please try to read the question carefully. Try to find these things when you are reading question, and after reading the question, try to go through options by elimination method. Like, don't randomly pick any option. Try to go with elimination method. So this is the ending of second chapter. Thank you so much.